Hello and welcome to this week's show. I'm Janet Lewis.
And I'm Dr. Lewis.
And we are Green Wisdom Health, home of the low-cost lab work, where now you don't have to guess at what's going on with your health, but get tested with low-cost lab work across the United States to find out what's really missing with your health needs. Today we are burning it up with kidneys and arthritis. And although that was a very popular Elvis song many years ago, I don't think the topic today has got to do with having fun. It doesn't sound really fun to burn it up with kidneys and arthritis, does it, Dr. Lewis?
It's not a hunk of burning love.
Well, it might have been at one point, but I'm not sure what happens to it after that. And this title came from one of our long-term clients, Tricia M., that wanted to know about kidney health, and I think the longer we started talking about it and rolling it back and forth, it turned into arthritis, and because all these things kind of relate, and we want to tell you how they do that. But, her question was that she reads more about liver and detox, but not a lot about kidneys. And I think there's more to helping that system than just drinking water, which is a great question. There really is. And that is something that really is not discussed. And kidneys, I know, when they're not happy, make people kind of, for lack of a better word for it, pissy.
I can't believe you said that.
Well, that's only in a medical context, which I'm sure that's a medical context word.
Right.
But whenever they have a very short fuse like that, I told you before it can be liver, but many times it's kidneys also. And one way you can tell that is if you're having to go to the bathroom frequently, and it's very scanty when you go, like you're not going near as much as what it felt like it should be. So can you explain to us why we need to take care of our kidneys and how that correlates to arthritis?
Well, it's true. Kidneys, Tricia, they don't get much press. And they're extremely important because they have to do with filtering all the oxidation, that happens in the body, the free radicals and things like that. Kidneys are very, very incredibly delicate, and they have to do with making red blood cells and putting out things that control your blood pressure too. You don't want to tax them too much, and some people have a little bit of knowledge but not much understanding. They say, well, I'm going to save my kidneys and not drink enough water. That way they don't have to filter as much water. That's about the worst thing you could do. The things that can adversely affect kidneys are all the toxins I keep talking about, but lead and mercury and aluminum and cadmium and manganese, all the bad heavy metals. For example, I talked to a dentist one time, and I said I wanted the mercury amalgams taken out of my mouth, and her and another dentist said, well, you're crazy, but we'll do it. And I said, but the mercury is incredibly toxic. She said, no, not really, but I'll do it for you. And I said, well, what'd your daddy die from? She said, kidney cancer. I said, number one cause, mercury toxicity. And he was a dentist, and she said, well, that's back when they were mixing up the amalgam by hand. They do it with a machine now. I said, it's still toxic. So sometimes people have good detoxification systems, and sometimes people don't. And, of course, we always touch on that. So, if you have urinary frequency pain upon urination, scanty urine rather than copious amounts, it could be that you have kidney insufficiency, and we test that on our labs and, look for optimal, not just within range. And how does it relate to arthritis? Well, there's a lot of different types of arthritis, but if you're not filtering out all the toxins in your system, they have to settle somewhere, and they tend to settle in your joints. If it's osteoarthritis, or that's wear and tear, traumatic arthritis, it tends to settle there, and it can go into psoriatic arthritis, rheumatoid arthritis, and lupus and things like that. But I want to talk about osteoarthritis to start with, just because I'm a chiropractor, and that's the bulk of what we treat, or by treatment slows down the progression of arthritis. Which, did you know, I'm going to go down another rabbit trail for Amanda.
Well, we wouldn't expect anything different, Doctor. We hear this all the time from many of our patients. Say they can't quite keep up with you and your thoughts.
I can't either. That's the issue. God, where was I going with that?
Down the other rabbit hole. Arthritis.
I do that all the time. But as you get traumatic events, and that will damage the cartilage, the ligaments, the disc spaces, one of the things, this is kind of a shameless plug, one of the things that is working is the chondroitin, MSM, but the main thing, we have already had, oh my God, good results with this collagen that we talked about that Eddie from, I think that's Illinois, asked about. And the reason I know it works, and Janet can tell you, the difference of type 1, type 2, it doesn't matter, just take it. We've been taking it a few times, so I'm going to make a long, funny story very short and boring. This week I got caught up in doing something very, very stupid. I know that surprises you.
Can I tell the story? Because people love stories. And since some of them are not here to actually see you in person, I know they would love to know what you've done. He doesn't want me to share this story.
She's got a grin, and I can't tell you what it really is, but it's kind of like a possum eating. Never mind. Go ahead.
He did it for everyone's welfare out there so that they could all hear, too. Because I want to know, I want people to know out there that Testoplex Plus works, which for you guys that don't know what that is, it is the testosterone builder that we have in our office. The reason I know it works is because my husband, sweet Dr. Lewis, decided that, he initially decided that he would refrain from lifting a couple of supposedly 44-pound boxes that came from Amazon to us that were minerals for his garden that had gotten wet. So they weighed more than 44 pounds. So they were extremely heavy, and they were on our office floor when we came to work Monday. Well, he said, I will wait until I get a young, strapping man in here to help me lift these so that I don't hurt myself. Well, a few days goes by, and in comes a friend of his, a friend that is younger than him.
10 years.
Yeah, only 10 years. And Dr. Lewis actually used to practice adjusting him whenever he was in chiropractic college. He would use him as a guinea pig.
I'd come home and adjust him on the Pennzoil cases at his uncle's gas station. So that's probably why his head's not on straight, because I wasn't a good chiropractor back then.
So this is the strapping man that comes in to pick up these boxes. Well, I guess because the Testoplex Plus must be working, this guy, Donald, offered to pick the boxes up and carry them out for him. Well,
he didn't offer. He just picked it up and slung it over his shoulder.
Okay, that's what did it. Then Dr. Lewis decided, I can do this too.
It was pride and stupidity. It had nothing to do with testosterone.
I had no idea this was going on, other than I see Donald come flying through with one of the boxes, and behind him is Dr. Lewis coming along slower, with a head that looked like it was going to explode because it looked like a tomato because
I got the
of his
heavier
blood pressure.
But I know mine was the heavier box, right?
Yeah, I'm sure it was. Which they proceeded to carry out to the vehicle. And for the last however many days this has been now, my husband's been not feeling so great from back problems from carrying out this box.
But the point is, it did not crater my back because I've been on the collagen. Normally, that would have put me down for about 2 or 3 or 4 days because of past trauma, which is stupid car wrecks when I was 16 and 19 and 20-something, and because of a gunshot wound that boo-booed a lot of things in my low back, and because I fell off a roof one time helping a friend roof a shed. But
more funny stories. Not so funny anymore. But the point is yes,
the collagen's working.
The collagen is working because I know what that would have done to him before, and he did recover quickly. But
see, I started out talking about the collagen, and she got into the testosterone stuff, and I'm...
Well, I had to explain why you thought you needed to lift the box, which if your testosterone wasn't up, you'd have been like, here, let him take both of them. So that's why I know it's working.
I got the look, folks, so I have to shut up.
Go ahead. Now on with your story about kidneys and arthritis.
Well, you can talk about kidneys. I'll talk about arthritis. So, because if you talk about kidneys, you'll get that word that you said, I can't believe you'd say. The thing about it is, in today's society, we get a lot of people that are anti-medical, which I do not understand. I mean, our medical profession is the best in the world. There's no doubt in my mind about that. but you kind of have to wonder where arthritis comes from, whether it's osteo or rheumatoid. The normal thing is take an NSAID, which is non-steroidal anti-inflammatory drug, which is generally ibuprofen or Tylenol, aspirin, naproxen, that kind of thing. Did you know that they actually speed up joint degeneration? That's what the research says. So we're talking about inflammation, whether it's the osteoarthritis, which is the wear and tear arthritis, or the lupus or rheumatoid arthritis, which is gastrointestinal. So you have to think, well, taking drugs is good. It's a noble thing to try to get pain down in a person and make their life better, but it just addresses the symptoms. And, even methotrexate, I've seen people get on methotrexate, but they know more about drugs than I do, and then they die early. It's like, well, because it killed their liver and kidneys. Janet and I do a lot of little adventurous trips every chance we get, and we were going through a podunk little town down in South Texas the other day, and I said, it's a shame. I cleaned it up. I said, it's a shame that in this little podunk 2-horse town that the most expensive building was the dialysis center.
You notice there's one of those in every little town there is now.
When you've got as many dialysis centers as you got Baptist churches and churches fried chickens, there's a problem, folks. And what is causing this kidney failure? And there's a lot of different things that cause that, but you need them. I've got 3 kidneys, and I tried to give one of them to this cute little girl that Janet kept out of dialysis for 22 months before she got her kidney transplant that she needed. And Children's Hospital in Dallas says we have never seen anybody with this particular condition that didn't have dialysis and throw up and have all kinds of nasty things. And they said, but it wasn't those supplements that you were taking. But we've never seen this happen any other time. And I told her, I said, well, baby, I've got 3 kidneys. If we're a match, I'll give you one. And she comes back. Now, she's originally from Holland, so she has the most beautiful little accent. She says, Dr. Lewis, that is very sweet that you would give me a kidney, but the doctors in Dallas said your kidneys are too old. Well, they're pre-broken in with plenty of beer and whiskey, so they wouldn't take my kidney. I'd have given it to her. She's a sweet little girl. So part of the reason we have kidney problems and / arthritis, it doesn't matter if we're talking about one or the other, all this applies. One of the things is drugs. And some of the things that I talked about, glucosamine, sulfate, chondroit, and MSM, they do provide symptomatic relief, and there are different qualities of these things. But it also opens up the sulfation pathway in the liver. Okay, lack of vitamin C puts you at higher risk for arthritis, but because it compromises the liver and their ability to detox, as well as the kidney too. And that's true, very, very true of acetaminophen or Tylenol.
Well, I'm pretty excited about the collagen because, for women out there, that is the fountain of youth powder because it helps keep the wrinkles away. Yeah,
if you saw her hair, you'd know it works.
And then to know that it also helps with arthritis symptoms and pain is just awesome. The other big one that's missing is the fish oil.
Right.
A lot of people don't talk about fish oil, but kidneys really do like fish oil.
And it has huge anti-inflammatory properties, although it generally takes about 2 weeks for that to begin to work. And, I had a guy come in here yesterday, and he's 60-something, has tremors and all that, and has all kinds of problems. I said, well, your problem's really in your GI tract according to your lab because of this. And, well, he kind of challenged me, well, why is your supplements better than any others? And I told him stories about $10 ladies of the evening down on the certain highway, and his wife was sitting there. She's a sweet lady, but he finally got convinced because I showed him research. I said, this is the preferred omega-3 fish oil. He says, why is it preferred? And I said, because it's a triglyceride ester instead of an ethyl ester, and I'm not a chemist. I don't know what that means. But the research, and I referred him to that, which he was not interested in once he saw it, said this is 393% better absorbed, and it doesn't cost 390% more money. So that's the Ortho Omega. It's some, oh my God, real stuff. It's not for sale on Amazon, because that's where that people take advantage and take the opportunity to try to counterfeit this stuff. So Ortho Omega, that's what I take. So if that tells you anything.
And we're excited about it because you only have to take 2 of those per day, where every other fish oil that we've had here, there were 4 per day.
And they were still better absorbed than most of the fish oils, but this one is the king.
Right. So.
Except I've got Stanley that I talked to today. Great guy. He just does what I tell him to do, and he gets great luck. He still takes 4. He said, well, isn't more better? I said, yeah, because it helps rebuild your brain, and that's why you're 56 and, still very, very sharp and, running marathons. But, the intestines, whether that's with rheumatoid arthritis or even kidney disease, or whether that has to do with osteoarthritis, it's the bacteria in your intestines, and it takes a long time and a lot of work to get the probiotics correct there, because the bad bacteria, what happens, they produce toxic products, which is called inflammatory interleukins, from Journal of Immunology and Journal of Free Radical Biology Medicine. Yes, Jonathan, I read this stuff.
Well, and I think the important thing with kidneys and arthritis is a lot of people are drinking Diet Cokes, things that are very high acid. And so that the kidneys can stay in a more alkaline state, because they're being dumped all this acid on, they're getting out of balance. So the kidneys are going, hey, I need to stay alkaline. Where can I get me some quick calcium? Well, it starts coming out of the bone, and that's what starts correlating between the arthritis and kidneys. So that's why they go hand in hand, because you have to keep your body in an alkaline state. So eating things with high sugar and, like I said, caffeine and caffeine, coffee, a lot of coffee.
Yeah, she's looking at my hot chocolate over here.
Oh, no. Just speaking in general.
You're right.
Things that are
you guys believe it, don't you?
acid forming will make the kidneys very unhappy. And,
that's what makes me excited, because she's as smart as she is beautiful, and God, I fooled her somehow into marrying me.
Okay, so now we're up to our question segment, which thank you guys for writing in the questions. We really enjoy your input here, because it just inspires us to just, I don't know, we just, we hear this so much and we talk about it so much, we forget what people want to know, and it really helps for people to ask. So anytime Dr. Lewis asks for these questions, which he does that on his shooting without a G, straight with Dr. Lewis on Facebook. So if you guys want to add him as a friend there, he will accept your friend request, and you can get in on all of his Dr. Lewis isms for free, and add to the chime in on the comments and add to this conversation and get ideas about shows for us, and we can help answer.
I told Trish Maples use wine for her kidneys, and she said she ought to be good then. So thank you, Trish.
Okay, we have a question from, I hope I say her name correctly, Marlena S. And she's asking about asthma and other breathing issues. What do you recommend? And I guess, why do people have asthma? What are you recommending for them to take to help with that?
Well, number one, go to a respiratory therapist, a respiratory specialist. And, of course, as a chiropractor, many times if you get the nerve supply balanced, you have sympathetic and parasympathetic, some that speed up, some that slow down, some that dilate, and some that, constrict. I've seen so many people under chiropractic care get better with asthma and breathing problems, and there's different nerves for different things. And the number one mineral that's usually missing is magnesium, which we're all deficient. Even our government, and we know how smart our government is, our government says we're deficient. And so magnesium helps muscles relax. So magnesium in chiropractic care is good. And there's one lady drive all the way from Dallas to get an adjustment for her knee and for her asthma. She says, I threw my inhaler away. I said, no. That might save your life. Don't do that. But she did it anyway. And I don't think you should throw away medicine. They do some really good things. Other things, you have to have good betaine hydrochloric acid, which that's stomach acid. Most of us don't, because that is actually a methyl donor, which helps to detox.
And asthma, also another big one as product-wise, in addition to chiropractic, is something called DMG, like dog, man, girl.
Dimethylglycine, which is similar to hydrochloric acid, which is trimethylglycine.
It helps oxygen utilization.
Yeah.
And actually a lot of people that have the, coughing. There was a guy one time in a restaurant that, oh my gosh, he just kept coughing and coughing and coughing and coughing. And I had some of these DMG tablets. Now we carry it as a liquid, but I gave him a couple of them just so I could finish my meal. He thought I was trying to help him, which I was.
She didn't want him coughing on her meal.
But within about 3 minutes, his coughing subsided. But it also, for an asthmatic, it really helps them take a deeper breath. So that's a great product. And then Dr. Lewis always mentions magnesium. It's a very important product for asthma.
And you really need to talk to us to determine the best kind of magnesium. And again, fish oil, because of its anti-inflammatory things, pantothenic acid, which is a de-stressor. Janet takes pantothenic acid because it makes me prettier, or maybe it just makes her able to live with me. I'm not sure. Selenium. There's lots of them that if you just throw in there, that God will bless your body because of it. But those are the main ones. And then bee pollen, since I'm a beekeeper, I'm moving beehives tonight. Bee pollen really does work, and I think you should support your local beekeeper, not buy the fake stuff that's in the grocery store. So that should help. I hope it helps. So good respiratory specialist and probably a chiropractor.
Cool. Okay. The next one is all yours because I have no clue what this is. Debbie B. And I'm with her. It says tendonitis. What the heck? What is that? And I guess how do you treat it?
Well, I've been flirting with her on Facebook. I did that today. Debbie's a girl I grew up with, the one that her family was kind of a cornerstone, a good family, somebody to look up to. And she wrote a thing on Facebook the other day about shout out to Dr. Lewis and talked about my family and ethics and hard work. And now that I'm coupled with Janet, well, Debbie, I'm just a good salesman. And why is it we grew up together and you still call me doctor? It's really okay. She remembers me as Stephen, who was a little bit impish.
Yeah. Oh, that's a great word. We both came up at the same time.
While she was making straight A's, I'd look at her and some of the other good-looking girls, and I say, I've been here 3 days in a row. I'll see you next week. And I'd skip school, and the principal would say, was the hunting or fishing good? But sometimes I was working to support the family. So the thing about tinnitus, there's a lot of possibilities, and I think it affects about 25 million people, and it's ringing, buzzing, hissing noises that has nothing to do with the external environment. So again, fish oil helps. CoQ10 can help. There's one thing I'm going to get to in a minute, but magnesium and manganese. Okay, manganese is not a very well publicized mineral, but you need it. Once upon a time, I had really bad tinnitus, ringing in the ears. It was horrible. Of course, again, I've done stupid stuff and had plenty of trauma. And I took something called vinpocetine. So, I'm a man. We're brilliant. If one's good, two's better. If a little bit's good, more's better. So I overloaded on it, which was good. And I did vinpocetine and huperzine A, and all the ringing in my ears went away because that will help revascularize inner and middle ear and brain too. And so I was back when we had some acreage, I was burning some stuff in a burn barrel. I think that's a southern thing. And it wasn't getting good airflow. So Debbie, your friend, took the 38 out of the boot, and I shot it through the side of the barrel where it would go through the bottom and exit and create air holes. And I did it 5 times, only because my 38 only had 5 bullets in it, but I did it without hearing protection, and my ears have been ringing like crazy ever since. So there's 2 morals to that story. You can pick whichever one you want. And also a good vitamin E. Most vitamin E's are not good, but a good vitamin E is really, really good for that and lowers your chance of heart attack, I think, by about 75%, I think is the percentage on that. So that's the story on that.
So you guys are getting a big insight today into Dr. Lewis' personal life.
That's why
things you don't see all the time.
That's why they call it shooting straight. I used to shoot straight.
And then Eddie has Eddie S. has a question. Are you able to touch on dry skin? I get massive dryness on my hands to a point where the skin cracks and bleeds. I would like to know if I'm deficient in anything or if there is a way to heal that. I remember having that myself.
Well, Eddie, I love your questions, and frankly, I love your post on Facebook. I appreciate the spiritual side that you promote. In my opinion, that makes you a better person, or maybe just more advanced. I'm not sure. Dry skin can be a lot of things, and can I touch on dry skin? I'd rather not touch dry skin, but that's okay.
Dry skin, kidneys.
Yeah, it can be.
Fish oil.
Fish oil is the number one thing. There's two different things that we have to think about. Sometimes there's not enough moisture, which the collagen actually helps maintain and hold the moisture. But we are oil deficient. We're so full of the bad oils, which is canola, corn, safflower, soy, cottonseed, that kind of yucky oils, and it's time for an oil change. So the omega-3s are good, and it's better if you can add borage oil and evening primrose oil, flaxseed oil. And when Janet had her LASIK surgery, I don't know why, because she's still young, and maybe it's to make me look better. But,
so I can see you better, dear.
Yeah. Y'all know BS when you hear it. That stands for belief system. So we got her some fish oil with borage oil in it, and her dry eyes got better and better and better and better. So that was a good thing. So same with dry skin. You have to add the oils, and I'm a real big fan of coconut.
Eddie, I'm going to tell you the one that really helped mine is the Ortho Mega liquid, because I take a teaspoon of it a day, and I can immediately tell my eye dryness is better, which is skin and hands and cracks.
Yeah, if you get enough of the oil in there, avocado, walnut, grapeseed, pecan oil, and butter. And I am not afraid of animal fat, even though they say it's saturated. That is not a bad oil. The bad oils is the transhydrogenated fats, so stay away from those.
Okay.
More and more oil. So, do that. You can take the supplements, and then you can add it to your diet.
Okay, and one last question we're going to touch on briefly here is Laura D. wants to know about CBD oil.
Does it work? In my opinion, absolutely. Is it a miracle cure? No. I think everybody should stay away from anybody that says this one product will make you young, rich, and good-looking and famous all in one fell swoop. They're full of it. Is it a good thing? Yes. I've tried 4 different companies. 2 of them are just total hogwash, smoke, mirrors, and baloney. I did not like them, couldn't tell anything at all. And Janet gets good results, probably because she pays better attention to her body, and that's more of a female trait. I'm not that prone to placebo effect, but maybe I am. I'm not sure. We got one that we have here, and yes, it works. We took it for a while, and it helped with stress and da-da-da-da-da-da. Does it take care of everything? I think not. And I think all these CBD companies are raping the public with the price. I have a friend of mine that's negotiating with a CBD oil company that they're telling him they will give us the same strength at 1/3 the price.
Yeah, the strength is where you have to watch it. I had a lady bring one in yesterday, and she had a 50 milligram cream, and she said, I can't tell this does anything. I said, probably not. The one that we have is a 300 milligram cream. Again, it's expensive. So
6 times higher, but it wasn't 6 times the price, and it's still too expensive. I think they're raping us.
But people in pain say that it's still worth it, because I still have them coming in here and buying it, because some people are in extreme pain. It really does help. And we have a topical cream. We also have a 750 milligram.
It comes out to 25 milligrams per dose. 25 is the kicker right there.
An oral one.
Right.
For total body. But again, it's not something that we try to do it with other things, just because the price is just, like Dr. Lewis said, I think they're just taking advantage of us Texans. I don't know if they're doing that to y'all in Colorado, but they are here. So we haven't really played that up very much just because of the price. But
you could spend that kind of money and get many, many, many supplements that would end overall would do your body a lot more good.
I do want to mention one more thing. If you guys are now very confused, I know you are not because we've explained everything so well, but people that don't know what's going on with their health and don't know if it's their kidneys or what's happening, today's panel that we're talking about to at least check your kidneys is our advanced health check that includes our consultation. If you go on our website to greenwisdomhealth.com and look at the featured lab panels, it's GWH6. It's $195. That does include talking to Dr. Lewis, so do not pick the extra consultation fee at the end. And that will be a good way to find out what's going on with your health to get started. And that's something you can order yourself online directly. And if you have a health savings account, they do accept those cards also. They look like a credit card and are used the same way. But we appreciate you listening to our show today. Please share this with someone that needs it. And we'll be back here next week with you for another exciting show on the Green Wisdom Health Channel. Thank you so much and have a blessed week.